I've hit that age where if I got socks for Christmas, I'm happy about it.
Yeah.
So it does happen. I'm going to get you to scoot your hips just a little closer to me, please. Thank you. And keep that one straight. Perfect. So, glad that door swung open and closed before I did this. Okay. So I'll get you to take a breath in for me and all the way out. Very good. Okay. Thuy?
Hello.
Good to see you again.
Good to see you.
Thuy has become a almost regular patient, I would say, at this point. She's been coming for the past couple of weeks regarding various job-related as well as activity-related complaints that I think I've been helping her out with. Else, I don't think she'd volunteer to make a video like this if she wasn't feeling she was getting something out of it. But I'm going to let her kind of take us through both why she came here initially and kind of the progress that we've made thus far. So, Thuy.
Imagine I just agreed to do this to slander you.
Yeah, that would...
Negative Google reviews.
That'd be very you.
Okay, so history. So this whole, where I'm at with my body is I have perpetually tight traps. Generally tight, neck, back, and that's been the case since 2017 or so.
Okay, 2017, so about, I can't math, but 7 years, about?
Yes.
6 years? Neither of us can math. That's a little embarrassing to put on camera, but it's going up anyways. Okay, six years. Okay.
And that's, it seems to coincide with me starting to work as a software developer.
Okay.
And software developers do a lot of desk work, and I haven't always had a good ergonomic setup. But anyways, when I work as a software developer, I'm on my laptop. But then when I get stressed, this happens, and then I stay like that for
they just don't come back down.
Yeah.
Okay.
Even though I have to really think about put your shoulders down, and even then I'm are my shoulders down? So since then, I've just seen a lot of practitioners to kind of keep on top of this body. At first, I was always in pain, so I saw RMTs to get relief. And then I got to a place where I stopped being in pain all the time, and now I just go for maintenance. And every now and then, I tack on a chiropractor because I think will help.
Appreciate it being tacked on.
Wow.
Love being tacked on. That's awesome. Okay, so thus far, in what we've been doing, we've kind of been taking that diversified approach of a little bit of massage, some chiro, the sports massage or the instrument-assisted soft tissue therapy, and that's all kind of been working, at least from what we've seen thus far. So today will probably look pretty similar to that, but first we're going to do a re-examination. So I've already done an initial physical on Thuy, of course, when she first came in, but it's good form anytime something changes or once a certain number of appointments have passed to reassess the patient to check for kind of the progress that's been made or if anything new is coming up. So that's important to do, and that's what we're going to be doing today. Does that sound good to you?
Yeah.
Okay. Anything else you want to say to the camera before we switch to
Do you want me to tell them how much you've helped me so far, or is that...
I would.
Does that help you?
That would probably maybe. I'm supposed to look good on my YouTube channel, so if you don't mind.
So I guess after all the RMT stuff, I've been seeing Adam for 2 weeks, twice a week, and I think the main thing that really helped me that you've done for me is the gua sha stuff, the Graston.
And that's the instrument assisted soft tissue that you've seen me do in other videos as well, and you'll probably see me do later today too.
Yeah. So I had for the last 2 weeks I had severe reduced range of motion with my lat. So I'm gonna shrink so straight. So I was this with this arm, and then after a lot of gua sha, you'll probably see the aftermath of some of the previous sessions. I'm able to kind of get to here, so
which is a good improvement. So thank you. Let's get into the physical then. Okay, sound good? Awesome. Yeah. So as per usual, let's just get started with the neck range of motion exam. So I'm going to get you to bring your chin down to your chest for me to start, please. And are we getting stiffness back here? Yes, no?
No, it's kind of fine.
Okay, a little bit more pressure.
I'm getting it more in my back.
You're getting it in the middle back region. So she's kind of pointing to the bottom of her trap muscles again. That goes from the top of her head out to her shoulder, and then down, connecting just to the middle back. So we'll come back up now. I want you to look up to the ceiling for me. Anything?
No.
No? Okay, a little bit of overpressure. Anything?
A little.
Where?
Like.
In the neck region?
Yeah.
Okay, right side, good. And forward. Check your blind spot. Rotate your head this way. That's about 80 degrees. A little bit of overpressure. 90, good. This side. A teeny bit less, but not much. And we're at about 85 there, good. Okay. Ear to shoulder. Good, and ear to shoulder. What, you got less on this side?
It seems to be the case.
Turn again, let me see that again. Good, and again on this side. They're pretty close, maybe a little bit less on this side.
It feels tighter.
Okay, good. Well, not good, but thank you for letting me know, rather. So,
yes.
We got tight left traps.
The usual.
Yeah, that's pretty standard for you. That's the lat too that's tight, right? The left one, I seem to recall.
Yeah, that's what we were working on,
Yeah.
but it's been better lately.
Good, I'm glad. Okay, so next time we'll get you to actually go face up, okay?
Yeah.
Straight up.
I don't think this is gonna go.
We're gonna see how far they go today, okay? So that's about where we're limited at a 45, 50 degree angle, maybe, but there's a lot of tight hamstrings there.
This is so sad.
Anything in the low back with this?
No.
No? Okay, good.
Yeah, like I have to, in yoga, I have to do it with a strap to feel flexible.
That's, hey, you know what? Sometimes you need a little bit of help. That's
yes.
Okay. So we'll bring this one up, which is better.
Is it? It feels worse.
This one we're getting up to about maybe 70 almost. So,
wow.
Yeah, look at that.
Wow.
Look at that. Left leg looseness. That's alliteration. Alliteration is fun. Okay. You mentioned the QL tightness. We'll get to that in a minute, but we'll also take a look at the lats. So this is the lat test, or the shoulder adductor test more specifically. This is her untight lat, the lat we haven't really been working on too much. She can get that nice up all the way, so there's nothing really there. Now, we'll take a look at the flip side, and I will try not to be in front of the camera too much, but again, we're going to bring this all the way up. And there's a little bit of resistance as we kind of get to the end range here. But beforehand, we could get to about here. Now we're here, still some tightness left, so there's a little bit more work to be done, but that is great improvement for Thuy. So, good.
My stomach's been growling, so hopefully...
I don't know if the mic's that powerful. It might have picked it up. We're just going to see if we can feel any lingering restrictions or tightness we got.
Are we in paraspinal territory?
We are very much in paraspinal territory, yes. So para meaning next to, spinal obviously meaning spine. So right next to the spine, this is our paraspinal muscle group and the one that helps us to stand up straight. So
That part's sore.
This part up here, yeah, because we're getting up into your upper traps here, which you were commenting on early, like especially on left. Are you left-handed again?
No, I'm right-handed.
No, you're right-handed. You got like more on your left, but you could be leaving the laborious tasks for your left hand. So for the people watching, I usually tell all my patients this, but I always encourage them to ask questions, comments, and concerns during the treatments because A, it makes sure that they feel heard, and B, it keeps me on my toes. So, I mean, I ask Thuy that I think 3 times every appointment. And for you guys, if you have questions, comments, or concerns, please leave them in the comments. Okay, so yeah, we've got a little bit kind of in the mid-range as per usual and left trap. Some on the right too, but it's actually not as bad as the left, except maybe for that spot right there.
Yeah.
Okay, so moving down, you mentioned some QL tightness. The quadratus lumborum, or the QL muscles, go from the bottom of the rib cage. They're another paraspinal muscle group that go down into the hip region here. So we'll go ahead and just kind of feel down as well. And even that, how's that there? That kind of feels like a little bit of a rock.
Yeah, it's like, it feels tender to me.
Okay. And then SI testing. So your sacrum, your iliac, your SI joint is the joint that connects those two bones, okay? So hands on your lower back, and that's the left side, okay. All right. So then next up, we're going to look for the tight gluteals, okay? So
this part's always fun to me because I rotate differently than most people.
yeah, so when we're examining gluteal muscles, really there are two that I like to pay attention to, the piriformis muscle and the glute medius muscle, excuse me. We have three glute muscles, glute max, glute med, and glute min. And glute med is really the workhorse of the three, in my opinion. It's like the middle child holds it all together and never really complains about it. But yeah, so first off, piriformis, following the sacrum down, and if we snake just off that about halfway, that would be the piriformis there, and we're just testing to see if we got any tightness or any kind of jump signs in here. And you were actually doing pretty well. You got a lot of internal hip rotation, so. Okay. And then as well. Okay, so that's a glute med. That's some glute med tightness right there. So I know what we're doing later. We're doing some glute med MRT. Get excited. Okay. And now we're going to do the other side again. Follow the sacrum down. Snake off.
I did do deadlifts yesterday. I wonder if that's
Okay, then you might be having some delayed onset muscle soreness or DOMS.
Yeah.
If that's the case, especially if you're doing your deadlifts correctly and you're really using your glutes, then yeah, that would actually explain that, and maybe we won't be doing the MRT there.
Wow.
Yeah, lucky you. You just knew exactly what to say, didn't you?
It's the truth.
Yeah. How's this one?
That was fine.
This one's not as bad? Okay. Okay. And relax. All right. I will get you to flip onto your back now. We'll feel your neck, okay? Okay, so I'm going to start by feeling that neck of yours.
My wonderful suboccipitals. Wow.
Right at the top. So, both sides, a little messy, but I think your left is worse than your right today. So, because I don't think I've done this one on camera yet, this is another example of MRT or myofascial release technique for the paraspinal muscles within the C-spine. So I'm pinning, I'm not using my elbow, obviously, but I'm pinning with my fingers, pulling the head up, and then rotating contralaterally or to the opposite side of the side that I have pinned. So pin, stretch.
So with the elbow and the finger stuff, is it about like pressure on the part? Like putting pressure on it to relieve it and then releasing it? Is that the idea?
Pressure and tension. So in applying that level of pressure or applying the tension, whatever you want to call it, you're able to relax the muscle in a way that massage therapy typically does. But specifically with myofascial release is that when you do pin that muscle and then you force it to move under that pin, is you are, you know how I explained to you that the gua sha is kind of breaking up the fascial restrictions, right? And the fascia, to people watching, the fascia is like a saran wrap layer that wraps around all of our muscles. You are able to release those through the pin and stretch mechanism. So that's why a lot of people will find MRT to be more effective than just your standard rubbing massage, right?
To the viewers, if any of my stomach growls make it to the video, I'm sorry.
I'd give you another protein bar, but those things are like $4.50 each, so yeah, Quest bars. Is that technically a sponsor? No, that's not a sponsorship. Never mind. All right, so I think we're ready to adjust.
Okay.
Okay. And yeah, Thuy and I have done this before, so we already have all the stuff signed. Very good. Okay, and now the left side. Gonna have to move the microphone for this. There we go, that can work. Okay. And
Nice.
very nice. How tall would you like to be today?
1 more inch works.
1 more inch. Okay, 3, 2, 1, here we go.
I'm tall.
Yay.
Although, speaking of that, like, I consider myself to be 5'3".
You consider yourself to be 5'3", or you are 5'3"?
So there's a reason for this language.
Okay.
So for the longest time, I'm like, I'm 5'3".
Mm-hmm.
That was my truth.
Yeah.
And then like every now and then I get my body composition done, like at a bod pod thing.
Mm-hmm.
You go into it, it's like a spaceship, and they shoot air pressure at you.
I've seen those before.
Yeah.
Okay.
And when they measured me, they said I was 5'4".
Oh, moving
And I
up in
was
the
like,
world.
do I have a new source of truth, or is this
That's like how
incorrect?
I believe that I am 6'3", and everybody tells me I'm 5'10". So I don't know, and only on a good day too. Yeah, I know 5'9" is probably even more accurate. Yeah, it's fine. Let me live in my denial. Okay, so we're just gonna feel this again.
It feels so ropey.
Yeah, they do feel like cables a little. Take a breath in for me, and all the way out. Okay, in, and out.
What does a shaking do after?
Pain gate theory. So sometimes when you're getting adjusted, you can get a little bit of a stinging sensation afterwards. But the pain gate theory is the idea that our brain is actually only able to register one sensory input at a time. So in the event that you do get that stinger, especially if I'm treating a rib, because ribs can be quite big stingers when they're adjusted, rubbing it replaces that pain input with just the sensation of being rubbed in that region, which can override feelings of pain or discomfort.
I think waxers probably use the same. I don't know if they think of it as the same.
Yeah, I mean, they probably just do it because, hey, it feels good, but, like, there's actual science behind that. Yeah. That plus it feels good. That plus it sounds good for the ASMR crowd. So. Yeah.
Hey, I'm an ASMR person.
All right. There you go. Big breath in for me, and all the way out, all the way out. That's a good one. So if I just did this, and I'm trying to do that, then down into the low back once again.
So what causes tight QLs?
What doesn't cause tight QLs is probably actually a better question. Our QLs are our primary muscle that lets us walk upright. So walking can do it, sitting for too long up can do it. Poor deadlift form is a big offender, so I haven't seen you deadlift, but I know that you deadlift with Ruben, the head strength coach at Primal here, so I imagine that your form is at least passable or good. But that's a big one for weightlifters that I see in here that aren't primal members, is that their deadlift form will actually be entirely back dominant instead of lower limb and glute exercise. So fun fact, if you're watching and you do deadlifts, you're not supposed to feel them in your back, although you might think that that's normal. Maybe a little bit of strain, but definitely not all of it. So I'm just going to put my hands on your front hips here, okay?
Yep. That part of my QL feels stiff.
Here.
But other parts of, well, when you do the pressure thing, it just feels stiff, like immovable. But like when you put it on like the, I don't know, like around here, it feels tender. So it's
Interesting. Same deal, this side, okay? So, to position you, I think you would maybe know this, but nice cat socks, by the way. I never realized.
Yeah. I think you're an appreciator of my fun socks.
I do appreciate socks. It's not about, I do, like, I've hit that age where if I got socks for Christmas, I'm happy about it.
Yeah.
So it does happen. I'm going to get you to scoot your hips just a little closer to me, please. Thank you. And keep that one straight. Perfect. So, glad that door swung open and closed before I did this. Okay. So I'll get you to take a breath in for me, and all the way out. Very good. Okay. Other side. This leg up. Hands are okay. You got hand positioning correct. Scooch the hips towards me, please. Thank you. That's good. Okay, so breath in for me, please. And all the way out. Very good. Good. So then, what are we doing next?
I just like to show everyone my fun socks. And my flat feet.
I've seen flat feet. Those actually aren't that bad. I'm actually going to get you to bring your arm up overhead like that, and whatever's comfortable for this one you can do. So looking here, we can see that she does have a little bit of petechiae still remaining from the previous times that we've done this treatment, specifically within her kind of like infraspinatus region, because that's the one that we've done most recently. So this kind of marking is actually quite normal when we are doing instrument-assisted soft tissue therapy or gua sha, and it's just an indicator that we've really worked the fascia well in that region. So it's nothing to be concerned about, even though it might look a little bit alarming to some people who don't know better. But anyways, you good to go for the light again today?
Yeah.
Yeah, perfect. Okay. So
earlier when you were talking about like folks who typically have QL tightness probably being like poor deadlift form related.
Yep.
I was thinking like personally
I
I
used
think
to
my
be that person.
deadlift personally I think my deadlift form is good. But then I imagined you inserting like interview clips from Roberto and Ruben in the gym, being like, what do you think of his deadlift form, and then them just being like, could use some improvement.
I promise you I don't have that much time to edit each video. I promise you that. But
well, that would be fun.
Yeah, it would be. But no, so I mean, a lot of people think they have good deadlift form, and even I thought I had good deadlift form for the first 6 years that I was deadlifting, and then then I finally realized, oh wait, I'm doing this completely wrong. So actually, I don't think they can see this on camera, but see, so here we've got some more petechiae just showing up kind of in that lat region. This is what it looks like when it just happens. This is what it'll look like after a couple of days. But again, totally normal and nothing to be alarmed about whatsoever.
Do you find that, I guess, like, the recovery time for petechia is different?
Yeah, it varies, and there's a lot of physiological play happening there. To be perfectly frank, I'm not sure why, but I just know that every body is different from each other. So some people will recover on the next day, it'll look like nothing's happened.
Wow.
Other people, like, it will linger for a few days, so you never know what you're going to get. But,
yeah. That yellow part, that's from Saturday, and the pinker part at the beginning was from Monday, and today's...
Well, today I don't see anything remaining on the lat.
Yeah.
So that's completely cleaned out, but... So yeah, really the most of it is actually just up on this lat insertion point because we're not getting much within the muscle belly itself. Let's check down here, shall we?
When you say insertion, is that like near the joint?
So every muscle has an origin point and an insertion point. An origin point is where it starts, and an insertion point is where it ends. And technically they can switch depending on the movement that you're doing, but that's getting kind of complicated. So the lat itself originates off of our spine, okay, down in this region, and comes all the way up to insert sometimes occasionally on the apex of our scat, the very bottom, but more importantly up into our humerus, our moan there. That's why it's actually directly responsible for adducting our arm, as well as extending it or pulling it backwards and rotating it as well. It's our handcuff muscle. So if you can imagine like being in handcuffs, that's the movement that our lats are responsible for, and it can only do that because it inserts onto our arm bone, else how would it pull our arm in? So yeah, so it looks like we got most of it out of the muscle belly last time we did this, because I'm not seeing any petechiae down here.
Nice.
Which is good. Maybe I just went a little light on the insertion, so that we definitely hit today, though.
Also for viewers, whenever Adam makes a middle child joke, it's because he's a middle child, and... he wants to be seen and heard.
And holds it all together, right? Yeah, exactly. It's okay, Mom doesn't have time to watch these anymore, so.
Does your family watch these?
I think they watched them. They were my first, 3 viewers, which was really nice. You know, they were there when I needed them to be.
Me and my siblings, too.
Wait, you guys watch these? Your siblings watch these?
No, but what I mean is,
or do you have a YouTube channel?
Yeah, I told you that I make vlogs.
Yes.
So they were my first subscribers.
Right? Family love. Okay, so I think that's actually all we're going to need because I scraped everywhere else. We don't have any, but definitely up once again into that insertion point. We're seeing a lot of that petechiae, so that's kind of the spot that we wanted to get today, and I'm happy to see that we were able to hit. So we've done this before, a little bit more myofascial release technique. We'll start on the right side just because why not, but I'm going to get you to start by bringing your head up and to the right. And I'm going to take that notorious pointy elbow and get you to slowly look down into the left, okay? Slow. Good. No, sorry, if I'm pulling your hair, that's not the intent here.
There's a little bit of hair. I'm losing hair, guys.
All right, let's clear that up. Clear up that back of the neck. Good. And once again, up into the right. And down into the left. Good. And up into the right. And down into the left. You're handling this better than Roberto did.
Okay, just so you know, everybody, in my first session, he was impressed by my pain tolerance.
I am continuously impressed by her pain tolerance. Yes, up and to the right. Thuy's impressive, what can I say? Good.
There was a point, too, where I was like, this is nothing, and he was like,
Shocked.
oh, yeah? And then he went harder.
I just gave her the flying elbow.
And I was still fine.
Tilt to the right, thank you. And here we're going to be doing the upper traps, which I know are tight. So I want you to slowly tilt to the left now, okay? And that's as far as you're going, huh?
Yeah.
That's okay. And good, tilt to the right. So it's very common that the patient won't be able to tilt all the way to the opposite direction. Go ahead. Because I am literally stopping them from doing that. So.
Yeah, it's like a physical obstruction.
Yeah. But then watch, as soon as I lift off, she can go a lot further, right? So, all right, again, tilt right. Good. And left. Good. Once more, tilt right. And tilt left. You know what, we're actually going to do that spot again. Okay, again, tilt right. And tilt left.
What's a trigger for you to be like, oh, we should do that spot again?
When it feels like it needs to be done again. Also,
is it like
because
it's
just being
stiff?
ropey or very stiff, or Okay. Now we're going to be doing the left side. So up and to the left, please. Good. And I'll make sure all the hair is cleared out of the way. And down and to the right. Good. Up and to left. Down and to right. Good, up and to left, and down and to right. Awesome, once again, up and to left, and down and to right. Good. Trap time, tilt left, good, and again, hair out of the way. And tilt right.
Fun fact, viewers, in my first session, Adam said he felt bad for my arm T. And I told my arm T that.
Tilt left. And tilt right. Well, yeah, because you're so stiff. I feel like they break themselves on your body.
Yeah, it never occurred to me, though. I guess it wasn't until you made that comment, and this is a lesson in empathy, everyone.
Tilt left. Because your arm T was immediately a massive fan of me. That's why.
Well, I just never thought. Well, yeah, I guess I never really thought about what the physical toll was on somebody who has such a tight body.
Now imagine somebody who doesn't have experience in working with soft tissues, like a romantic partner, and you ask them for a massage.
Right.
So this goes out to all the girlfriends who ask boyfriends for massages. Appreciate the hard work that we put in for you. Okay, there you go. Mm-hmm.
PSA.
You're welcome, guys. I got you. Mm-hmm. We're gonna do one more, okay?
Yeah, that one's a
doozy.
Yeah.
Good. Okay. Now, would you like some acupuncture on those for today?
Yeah, we can do it.
All right. So, first things first. Why don't you just let me know if these are excessively painful, and they'll come right out, but you shouldn't really feel anything more than a little tiny pinch.
Okay.
Good.
So earlier you explained to me about how you do non-disinfecting for this. Just for people who might not be familiar with acupuncture, why don't you disinfect?
Yeah, so we've actually done some studies on that, and it seems that the rate of infection isn't any different between sanitizing the skin and not sanitizing the skin. That being said, if you do go see a traditional Chinese medicine practitioner, you may see them still sanitize the skin, but that's more out of habit, if anything, because it was previously thought And you'd think it's pretty common sense that, hey, sanitizing is safe, and I agree with you, usually. But for whatever reason, it seems that there actually isn't any statistically significant difference, and to anybody who knows anything about stats, means that it's essentially pointless to do. So personally, I opt not to. If a patient is uncomfortable with that, that's fine. I can go find a first aid kit somewhere, but it really isn't, it's going to result in no difference. And having done acupuncture, like, basically since I've opened up about 7 months ago here, 0 infections so far, so. Nice. That's a good one there. Good.
That one's a tight guy.
That one's a tight one, huh? Yeah. That would be in your supraspinatus, actually. So there's your spine of the scap right there, supraspinatus belly.
And truthfully, I've only ever gotten acupuncture done, I think, where they disinfect, so it was news to me, but
You're learning stuff today.
I trust you.
Good, I trust you too. Alright, so.
I admit, though, like, until I had my TMJ thing, I thought acupuncture was a bunch of woo-woo.
A lot of people do.
But then, you know, someone I trusted said that acupuncture worked for them, and I was like, alright,
That
I'll
knee
try it.
is stubborn. We will try that one again. I mean, that's the case with a lot of these kind of paramedical professions, is that for whatever reason people have a stigma or they think that it doesn't actually do anything, and then out of usually desperation they try it, and there we go, that one's going in, and then they realize that, oh wait, this actually kind of helped me a lot. So Ooh.
Yeah, that's super spinatus.
Yeah. That was actually the tail end of your traps over there, so not quite, but.
Yeah, the farther out ones.
Let's find that supra. So, spine of the scap is right over here. And, yeah. There you go.
Whoa, I felt like a twitch almost.
Yeah. Okay, good. Alright, so if any of those, for whatever reason, start to feel a little bit of creeping on pain, let me know, but I don't think you should be dealing with any of that. And here's what we will do. So, I'm going to hook you up to a little current.
Oh, okay.
Yeah. See if we can get some stimulation going. So. Let's close that. Okay. So I'm going to try it one way. I'm going to try to connect them across your back, which is to say, connect these three to one individual circuit, because I only have 3, so that's kind of an awkward number to play with. But if it doesn't work, then we'll pick whichever trap is tighter for you and see what we can do from there. Okay, come on. There we go. There's one.
How strong is the current?
It's as strong as we need it to be. So what I will do is I will start it off light, and we're trying to look for a muscle twitch, okay?
Okay.
So you can just let me know if it's too much or whatnot. I could never be a surgeon. Okay. Good. So just pull your hair. Good. Okay. So I'm going to turn it on very light now, and you may feel a little kind of tingle to start, okay?
Whoa.
There we go. All right, so.
We're twitching.
Yeah, there we go. How is that? Is that too intense or is that tolerable?
That's tolerable. We can keep it here.
Okay. You like it there? Do you want it heavier or less, or that's just the sweet spot right
That's
there?
just a sweet spot.
Okay, so as you can see, and actually just going to make sure you can see it on the camera. Yeah, the muscles are twitching there. So, can we see that? Yeah. Yeah, I'll just saw my nose. Yeah, my mouth. But still. Okay, good, we're good. So what we're going to do now is we're going to leave you there for about 10 minutes. Okay, I'll just be right across the room, so you let me know if you need to take them out for whatever reason, okay? Otherwise, enjoy your nap.
I have fallen asleep with needles in me, which is surprising because I don't do well with needles. But for any viewer who's curious or interested about acupuncture, but you don't do well with needles either, they are honestly, they're so small and you barely feel anything, but you might get that involuntary like sweat thing just because there's needles in you. Mm-hmm. So I'm kind of concentrating myself.
So what Thuy is referring to there with the involuntary sweat thing is anytime we do acupuncture, it's possible that somebody gets something called a sympathetic response, and that's specifically referring to your sympathetic nervous system. Now, you know that our nervous system, we got it's autonomic, meaning that it's autonomous. We can't really control it per se outside of some controlled breathing exercises, but we have our sympathetic and our parasympathetic. Our sympathetic is our fight response or our fight or flight response in terms of sweating, decreasing digestion, upping our adrenaline, stuff like that. So yes, a needle insertion can cause you to sweat, is what I'm trying to say.
Yeah. Is the twitching rhythmic because the current is rhythmic?
Yes. Yeah, so there's really two kind of mindsets between using acupuncture. You can either take the pain gate approach, which just involves doing it only until you feel tingling, not twitching, which is the same thing as me rubbing you, right? It's just it's a sensory stimulation to override pain perception within the brain. And then there's the muscle twitch, or some people refer to it as the opioid release technique. Now, I know a lot of people get scared when they hear the word opioids, but we naturally synthesize a very, very, very small degree of them in our body. It's totally fine. But the muscle twitching stimulates that in a way similar to physical exercise can provide a therapeutic effect. So that is kind of what we're looking for. And I typically use the muscle twitch method over the pain gate method with my patients.
I hope I look buff in these videos.
Sorry, Thuy, I'm not great at Photoshop.
Or at least like I'm sort of fit. It'd be nice.
You are fit, Thuy. You don't make no mistake, okay?
Woo.
Seven more minutes, by the way.
Okay. It's bearable, but I think it feels more intense on my right, which is interesting.
It could just be perhaps the depth of needle insertion. It could be a few millimeters more. Acupuncture really is like you don't need that much of an asymmetry between the needles to get an effect. So.
When you do adjustments, do you find that most people close their eyes during it?
I don't really pay attention to that. Truthfully, I don't actually look at my patient very often when I'm adjusting them. It's all done by feel. So I know, like, when you're starting, if you're a chiros student who watches this, when you're starting to learn how to adjust, a lot of it is like visual. You're looking at the position of your hands and the end ranges of the patient's neck, for example. But once you get pretty good at it, you don't actually rely on the patient position as much as you do just based off your hands and what you can feel. So I've kind of reached that point where, honestly, if you watch me adjust, I'm actually kind of just staring off into space. It's very weird. I don't know what I'm looking at because I'm almost entirely focused on what I'm doing with my hands. So it's weird. It's definitely a learned skill.
Yeah, I've seen chiropractors on YouTube. Some of them close their eyes during it because of the whole feel thing.
Yeah, I do that too sometimes, not super frequently. I end up staring off into space.
Yeah. Sometimes in chiropractor videos I see them with this like roller thing.
Roller thing. Could you explain
Yeah,
that
that
a
probably
little
doesn't
more?
really help. It's like a bar with two tiny wheels that they roll up and down your back.
Oh, that's a paraspinal massager.
Oh.
So the little gap in there is meant for your spine, so
Yeah,
it doesn't directly roll over a bone because that's uncomfortable. But the wheels themselves will roll up and down those muscles. You just try to release them a different way. So yeah, if that's something you could do, I just prefer using my own hands for it, and I find most of my patients do as well.
Mm-hmm.
So.
I was looking at your wall of certificates, and I like that you have the ones from chiropractic school there.
Mm-hmm.
Is that from? Are those all from your student council days?
Yes and no. So, I won a total of 8 awards during my postdoc, which is a lot. It's I mean, most students don't really get any, but I happened to win 8 because I was hyper involved in my school. The 3 that I have up there, the Ontario Chiropractic Association Award for both 2018 and 2019 is from those 2 are from our advocacy body, who it basically just shows, okay, a chiropractic student that shows a lot of promise, which is nice to hear from the people who are kind of like there to support us, right?
Yeah.
And then the Scott Poulter Memorial Award specifically, sorry, let me finish my vitamin D tablet here. The Scott Poulter Memorial Award is a really important one to me because it is decided on by a vote of the students within your class. So there's about 200 people in the class, and they just type in a name. But it's decided based off of somebody who, in their opinion, embodies the spirit of their class and is the kind of like a driving, like a leader and somebody who they know really represents them well. And I was the name that got chosen for that. So it was very, very touching to see and made me feel very special and appreciated. So if anybody in class of 2021 is still watching these videos, thank you guys. I still remember that, honestly. And then the other 5, I mean, I only put up the 3 that mean the most to me. The other 5, granted, like, this sounds kind of conceited, but there literally isn't enough room on the wall. So I just kind of chose those ones. And then my legal certificates, those are important. So
Yeah.
Mm-hmm.
I forget what video I saw this in on your YouTube, but there was a brief clip. It looked like professionally videoed at your school.
Mm-hmm. Of me
You're
showing anatomy, right?
Yeah.
So that's from a promotional video for CMCC, but I did work in the anatomy lab and I was an anatomy tutor, and that machine itself was referred to as the anatomage table, which can be used as an additional cadaver in our cadaver labs because we do have cadavers. And honestly, everybody preferred to use the actual cadavers. Like, I prefer to teach on a cadaver, but whenever all of them were being used in the process, you could revert to the anatomage. Granted, although not many students relied on it because I think it had some RAM processing issues. It was quite slow on loading everything. So, but yes, I'm a fan of that shot. It looks very well done. All right, I think that's it for the Acu for today. That's our time. So I will turn these down now. Okay. So the twitching has stopped. I will remove the pins. Don't move just yet, okay? I gotta take the needles off you. Okay, so. Okay, you are needle free. You can stand up. All right, Thuy, and how was your appointment today?
It was good. It was good. We'll have to see, like, if it resulted in improvements, but I'm optimistic.
Well, we'll know when you're trying out Pilates later. I know that you said that you were going for that, and as well, like, overall, we've already seen quite a bit of improvement with Thuy based off when she initially came in, specifically in that lat range of motion. So you need to understand that with these things, there is diminishing return. So that's why you don't want to be coming back to a chiro literally forever. So if you do here 3 times a week for the rest of your life, honestly walk out, because that's not going to do you much benefit. The most benefit you're going to get is immediately off the bat, and the intent from there should be to dial back the frequency of appointments as much as possible before symptoms begin to onset again. So like if perhaps you start to feel that stiffness creep back up every 3 weeks or so, come in maybe every 2.5 weeks just to like knock it back at bay. All right, but still, I'm glad you enjoyed it. That's good. You put on a trooper face for the acupuncture. And I want to know how Pilates goes for you later, okay?
Yeah, I'll let you know.
Otherwise, I guess we can say bye for now. Thanks for watching, guys. Really appreciate it. And Thuy, I will probably, I think, we'll figure out when we're scheduling you next for, right? All right. Well, take care. Thanks.
Thanks. Over here, so. You like zoom in your sustenance.